Good afternoon, Enid. Mayor George Pankonin here with a little update. I don't know if you've heard, but the 4th of July weekend is coming up, and I thought it'd be a good time to review some of the rules and find out what's going on and what we can do to help keep each other safe during this holiday weekend. So with me today is Rae Johnson from the County Health Department. So I wanted her to go through a few of the things that suggestions for making us helping us to keep each other safe over this holiday weekend. So, Rae?
Sure. So, as we all know, COVID is not over. We're seeing an increase in numbers in Garfield County. I think our total cases is around 75 at this point. We're still testing every day and seeing a lot of positives. So, it's really important that we still, keep up those safety measures, especially with 4th of July. This is one of those times where it's really important to keep safe because people kind of let their guard down, and that's when we're going to see a big spike. So things that we can do are wear face coverings, wash our hands, stick to your family. Just because it's the 4th of July, we really don't recommend, going to those big, especially enclosed gatherings. That's just kind of the worst place you can be. If we can share the graphic this is from the Colorado Department of Health, but I think it's really helpful in showing, kind of safer activities to more, you see there. So if you're doing something camping, outdoor related, is about your safest thing. Dining out, when at restaurants that are, really good about the social distancing, are a little bit more safe. And then if you're going to be like in a bar, nightclub scene, or in any kind of large gathering, those are really where we are seeing a lot of cases. And that's from Colorado, but there's no difference for Oklahoma. And one thing, if you go outside to watch the fireworks, that's okay. You can space yourself out, bring a blanket, make sure your family's close, wear a mask. And then you can sit there, but then going to, those big barbecues and stuff, some people are gonna get sick and we're gonna see some cases. And if you have any of those factors that put you at a higher risk, like diabetes, heart disease, over the age of 65, then you really need to consider, is it worth it to put myself at risk? Or if you have a family member or someone that you're close to that has any of those conditions, you need to really outweigh, is it worth it? To possibly risk someone getting ill and someone getting very ill. So.
Right. Okay, good. Well, thank you. Now, for people that would like to hear the symphony that's going to be doing their 4th of July concert, or want to be involved, or watch the fireworks that's going to happen, there are ways you can do that without having to go there. If you're concerned about your health and you want to watch it, I can't promise how good the reception will be because you're trying to broadcast from an area that's kind of an uncontrolled environment that doesn't have a lot of technical signal and all that. But if you want to go to the City of Enid government Facebook page, we're actually going to stream both the concert and the fireworks, so you don't have to feel like you have to go out there to see it.
Yeah, and I know you can stay in your car for fireworks and watch them from your vehicle, or if you have a truck, watch them from your truck bed, and just try to avoid those large crowds of people.
Yep. Good. You talked about washing your hands frequently, keeping masks on, trying to keep social distance. I've seen a lot of people used to shake hands all the time. It was just a formal, informal greeting where and I've seen a lot of elbow touching, a lot of high five from distance and not actually even touching each other. So I think our social behavior is being modified quite a bit. And I'd encourage you to keep doing that. I mean, the closer you get, the worse it's going to be. So.
Yeah, yes, sir, you're right. Keeping that 6 feet in between people, and even this, hold your breath, wear a mask. Yeah, right. It's still too close. So I like the air fives and the hey, how you doing? I know when I see friends I haven't seen in forever, I always want to give them a hug, but we just can't right now. It's it's the way the world is, and we need to keep ourselves safe and keep those vulnerable populations safe. So.
Okay. Let's see, you're right, COVID-19 is not gone. There's more testing available, and more testing means more positive results, probably. Sometimes they're asymptomatic, but somebody comes back and says, you know, I went to Oklahoma City last week, and I found out somebody I was having dinner with had COVID-19. So, and I've talked to 10 people since then. Well, what's happened is there are lines occurring at many of the places that offer tests, and it's because people know that they've been exposed. So they may be completely asymptomatic, but they know that they've been exposed and they need to be tested. So what you're seeing is a lot of lines at a lot of places that are offering that. So we're trying to see what we can do to help with that, and the city's even looking at maybe trying to help with some of that demand that's becoming higher. But I think the health department's also got some ideas that they're planning on in the near future, right?
Sure. I wanted to talk about our testing event, but we were just showing a graphic that I think is really good and really explains that even if you have symptoms and you get a negative test, that doesn't mean you don't, you know, the testing is not 100% accurate.
Right.
So if you're symptomatic and if you've had contact with a case, you need to stay home, you need to isolate.
Right.
If you've been in contact with someone and you do get a test, because we are testing people that have known close contact, and get a negative, if it's been with less than 14 days, you still need to quarantine because you could develop symptoms or still become an asymptomatic carrier in that 14-day window. So that's really important, and it's hard to, it's a little bit confusing because there's so many different scenarios and possibilities, but safe is best, and that graphic's on the Garfield County Health Department page, and I think it's a really good one for people to read over because it kind of explains when you need to be home and what you need to do. But because we are, you know, testing has really ramped up, and we have decided to do a large-scale testing event at the Garfield County Health Department on Tuesday. So we're going to close our clinic. The health department will still be open for WIC and answering phones and stuff, but all of our nursing staff is going to be outside testing. We're hoping to do around 400 tests. So if you call the health department, here's the kicker, you have to call today or Monday to get on the schedule for Tuesday. You'll be given a time window of when to drive up. Good. And then you'll be swabbed at your vehicle. But the really important thing is that you call before, so those nurses already have your information, have your screening stuff done, your lab forms filled out, and we can get you swabbed quickly and get you on your way. So that's the big push we're making right now for testing, because a lot of places are, you know, the lines are crazy. We're having a hard time keeping up. We do, I mean, close to 30 tests a day, and you know, we're closed tomorrow. We're closed for the weekend to be with our families for the 4th of July, and so Tuesday is going to be our big testing day, and we're going to see how this works, and then it could turn into something like once a week or once every other week we do a larger scale testing event where that's what we do for the whole day to kind of keep up the demand with the demand.
Yeah, excellent. That's very responsive. I think of it almost to like the drive-through thing we did at the Expo Center.
Yeah.
Only you got 4 times the capacity in a much more controlled environment.
We are really good at testing now.
Yeah.
Our nurses are awesome. So we've got it. They can, I think it's 20 an hour a nurse can do is what we figured out. And so,
oh my gosh.
So they have a system, and it's going to be really hot out there for them. So we need to make sure, you know, our big thing we're stressing is we don't want people to just show up, and because it's kind of going to throw the system off, and we need to keep conditions safe for everybody because it's going to be a hot day. So if you do want to test, call today or call on Monday, and we'll get you scheduled. But it's going to be hopefully very helpful.
Excellent. Well, thank you so much.
Yeah.
You know, one of the other things that I wanted to just briefly talk about is I've had businesses talk to me as I walk in, and they'd say, okay, all the restrictions are off, so we can just open up the restaurant now, and we don't have to mark all those tables off, so we're going to get a lot more business. And my message to the vendor that I talked to about that was, I don't think that's a good idea. Everybody's looking for a competitive advantage over their peers. To me, a competitive advantage is leave half those tables marked off, because I can tell you, if I walk into a restaurant with my wife and we want to sit down and have dinner, if I see that the place is packed, I'm probably going to go out the door and go to the next restaurant, because if I don't feel safe there, I'm not going to eat there. So I guess my message is, would you rather have the place half full with customers that are happy that you're doing the responsible thing in regard to their safety, or would you rather have the whole room open and be empty? I mean, which way do you make more money?
Yeah.
I think you make more money by taking into consideration the customers and keeping them safe. So that would be my message to everybody. We need to keep doing it. This thing ain't going away. There may come a time, you've seen other communities have already started tightening down and reverting back to phases. And frankly, we're talking about that. And the way that we avoid that is by being responsible ourselves and doing the things that we need to do to keep each other safe. So we're asking the businesses to be aware of that, and we're also asking all the customers that go into the businesses to be aware of that. So the more we can keep it away from ourselves, the less likely it is that we have to do things to make that happen. So I'm just looking for everybody's support in that, and I guess that's my message.
Yeah.
But did you have any closing remarks?
No, I totally agree with that. I mean, just because you can doesn't mean you should, especially in this in this situation. It's like I said, it's, you know, maybe you don't have the pre-existing condition or the advanced age, but I guarantee you that you probably do know someone, and so it's really important that we still protect those people, because we're still seeing a big jump in cases and still seeing some deaths, and so yeah, if we want to keep open and we want to keep, you know, our friends and family safe, then we need to do all these measures. And I'll share on the Garfield County Health Department page later, but there's a lot of questions if masks are effective. They are. When I wear my mask, it's not to protect me, it's to protect you. And when you wear your mask, you're protecting me and not yourself. And the more people that wear masks and the farther apart we are, the less you know, spread we're going to see. So I guess just if you have to go out, try to remember your mask and avoid touching anything and wash your hands as soon as you can.
Yeah. No, I think those are all good points. You know, it used to be, I think when this thing first started, I was kind of self-conscious to wear a mask because in our society, we're just not used to covering our face. It's like we're hiding something. But to be honest with you now, I'm uncomfortable if I don't have a mask on and if I'm in a place where people are not wearing masks. I think we're evolving and getting used to it, but we're not there yet. There's a lot of people thinking, yes, I'm glad we held our breath for a long time and now it's over. It's not over, folks. We're in the middle of it, maybe, but we're nowhere near the end of it. So just need everybody to modify behavior a little bit and let's protect each other.
Yep.
All right.
Well said.
All right. Well, thanks, Enid. And again, we're looking for everything you do. I wish you all a safe and healthy 4th of July weekend. Be with your families. Enjoy your time together. But let's keep each other safe. If there's anything that we can do to help you, please let us know.
Thanks, Enid.